ladies and gentlemen. The post-lunch session is always a difficult session to be speaking on. What is known as postprandial hyperglycemia, that is the rise in blood sugar after a meal, and also a good sweet dish and coffee keeps many people outside. So at the outset, let me thank the organizers, and especially Dr. Zotpe is chairing this session. It's a privilege for me to be here. And Dr. Sandeep Sharma, who's the chief medical person here, Dr. Dubey, and gentlemen on the dais. I will not take you through some of the stuff that we've already talked about, and thank you, Dr. Dubey, for letting me have a segue into where we are going and how we can go further. So, non-communicable diseases, in layman's language, because we have a wide variety of audience here, is basically any disease which is not infectious. So all the major ones like cancer, cardiovascular, diabetes, stroke, renal disease, and so on are the most, and they unfortunately affect the most potentially productive years of life, between say 30 and 60 as the time when it is maximally there. So roughly 60% of all deaths, that is more than half in India, are due to non-communicable diseases. So that is what I'll be focusing on today. This is the whole list. I will not repeat it again. Practically any disease and every disease which is not infectious is included. And unfortunately, it is on the rise. You may blame it on your lifestyle. You may blame it on the food that you eat, amount of exercise, if you have an addiction, which is tobacco, alcohol, areca nut, or whatever else. These are the main factors which are cross-cutting over all these diseases, as you can well make out. So it's a major threat to public health. It calls for international and national action, and I'm so happy that so many companies are now engaged. We just heard about Indian Oil, but I'm sure there are many others which I will briefly talk about. I just talked about lifestyle, eating habits, tobacco, so on and so forth. These are the main issues that are involved. And it is a rising epidemic, not only in the world, but also specifically in developing economies or emerging economies like ours, which are transitioning from a low to a low middle class and hopefully to the upper class as we go along in the years. 66% of total deaths just about 2 years ago in India. 116 out of every 1,000 individuals will have a NCD, and more than 2/3 of the individuals who are suffering from NCD are between 26 and 59. So it is the most productive years of life. Comprehensive monitoring is important. The ministry has committed to the WHO's Sustainable Development Goal, SDG. SDG 3 is where we are worried about, talking about prevention, treatment, promoting not only physical but also mental well-being is important. Similarly, we started off in 2010 when we had the national program for controlling the diseases was started. Voluntary review was done in 17. In 18, we had the non-communicable survey. And very recently, in 2019, ICMR, which is my previous organization, actually started 2 institutes dealing specifically with NCDs. The role of the private sector, because I know there may be many people both from the government and private here, it is extremely important. All of society taking a One Health approach is important. Similarly, the WHO action plan suggests a multi-stakeholder engagement. Not only people from medicine, but from economics, from industry, from a wide variety of spheres have to be working together if we really want to have some degree of control on this particular problem of non-communicable diseases. So the UN political declaration also recommended engaging non-health actors, because somehow we as doctors somehow tend to interact with other doctors, and that's the end of the story. So though that time is over. So when I got this invitation from Dr. Sandeep, I immediately said yes, hopefully we'll meet people from different spheres rather than being the traditional coup mandoop, that I am the boss, I know everything, which is obviously not true. We all have to work as a team. So private sector plays a significant role. It has recognized itself as a driver of innovation, especially in India, for example, practically 80% of our healthcare is in private hands, and it's extremely important that they have to be involved, not to, because as any company, which I'm sure you're well aware, has to be donating in CSR about 2% of their turnover if it is more than a certain amount of money. So I will not bother about telling you what is CSR. You know that fully well. The law mandating started off with a net worth of 5 crores. In 2013, this rule came in. But as my previous speaker has talked about, Indian Oil has, and many other institutions have been donating money well before the rule came in. So it is mandatory to spend on these 4 or 5 different areas: education, community health, and socially relevant issues. Evidence of support, these are various news articles that we could see and how there have been academic articles written on reaching the last mile and talking to the people who are unreached so far, what is the importance. So healthcare, of course, this is what I'm talking about. Total sum of eligible spent already, practically 25,000 crores, out of which the lion's share, that is about 7,000, was in healthcare. A 30% boost has been there in healthcare, and primarily due to COVID. Now, hopefully, COVID is showing us the rear view mirror, and we should be focusing on non-communicable diseases as soon as we have the green light. So how to increase the public-private partnership? It is, I know we all talk about it, and unfortunately, having worked in the government for many years, it is still something we are grappling it, how to make it really effective. But a lot of activity is there, and I hope there will be more and more public-private partnerships in real life rather than just on paper. OCCUCON, which, as you know, is a drug company based out of Bangalore. They've been targeting diabetes, cancer, and autoimmune. They have developed NCD clinics in areas in Karnataka. Similarly, we have Reliance Industries, Hindustan Zinc, Cadila, Torrent, and you can see the amount of money which goes into hundreds of crores at times. They were talking about a health club, dialysis center, sickle cell anemia or hemophilia, which is a bleeding disorder, and then NCD consultation and lab services coming in from various companies. Similarly, you have Britannia, Bajaj, and Grasim. This is the amount, the total amount is between 30 to 128 crores, in which they are talking about preventive health. Unfortunately, preventive is a relatively unused word in our country. Most people will only go and see a doctor or a dentist for that matter, only when our teeth are falling out and we are in agony. Hopefully, by various awareness campaigns, benefits from income tax for health insurance, and various people who are covered, most of you, I'm sure, in the audience are covered by various insurance schemes from your company or otherwise, but most of the country's population is not. And that is where I think the Honorable Prime Minister also talked about in many of his talks about how prevention is better than cure. We all know it, but how many of us actually go in the field and go for a preventive checkup until or unless it is mandated by your company or by your organization? My own background being in the armed forces, it is mandatory. There's no way of getting out of doing a medical examination. And I can tell you, one of my senior colleagues who was a brigadier in the army, he got diagnosed with a very, very small pinpoint, or little more than a pinpoint, lung cancer. It was operated immediately, and he's fit and well now. This happened with a good friend of mine. And these are few and far between. But if he hadn't had that X-ray, I'm very sure he would no longer be with us. This is just to give you an example what is the importance of a yearly blood checkup, of an X-ray if needed, an ECG, and a physical examination. So how can CSR contribute to NCD? These are the 5 pillars, talking of innovation, healthcare, investment, governance, and public-private. These are the 4. I know we keep talking about them, and I'll just mention one line about each. I'm sure most of you are very well familiar with the details. As far as PPP, I already talked about. Resources can be directed towards NCD mitigation, NCD prevention. Make sure you get affordable, high quality. Because high quality is important, but also it is accessible and affordable to the people who need it the most. Similarly, in health promotion, public education, you hear when example is anti-smoking or anti-smokeless tobacco ads that you saw on television, and before every movie, you had Mukesh and 2-3 other people who were, they were real life patients. I actually met Mukesh as well as, I think her name is Seema. She was sitting next to me in a function at the ministry, and unfortunately, neither of them are with us. Smokeless tobacco is practically 80% of all tobacco we consume in our country. We always talk about stop smoking, but our real problem is smokeless. Anyways, that's a story for another day. Governance, of course, public and government perception of industries, how improving the regulation is there, improving the NCD burdens, and also lobbying. The policy influencers, and I'm sure many of you are here in the leadership positions, you are the people concerned to lead the way as far as changing of policy, and not only the policy, but also implementing the policy. Mr. Dubey talked about the hospitals in Digboy, and you talked about Mathura and various other places. Those are the places where you get a window opportunity to educate a person. And not only you educate that individual, ideally a lady, then that way the same information is passed on. They become master trainers, or as we know in our language, training of trainers. So individual, especially when he or she comes for to the hospital for a not so serious emergency, they are the most receptive at that particular moment. So education, of course, is important. So provision of healthcare by early diagnosis, making sure you have infrastructure, availability, accessibility, and affordability, I already talked about. Innovation, of course, monetary or in kind, and I'll talk about some of the innovations which have been funded by the industry, which are going to come into use very, very shortly. Process innovation, product innovation, as well as dissemination, because not only should be seen to be doing good, we are also be doing good and making sure that the information is passed on to other relevant stakeholders so that they can learn from your successes and also your failures of avoid what to do. Investment, we're talking about health insurance, I already mentioned. There's a Ayushman Bharat scheme, which provides up to 5 lakh rupees per year for any serious emergency, whether it is cancer, heart attack, or diabetes. Subsidization is a controversial term, but it is needed for certain people. And of course, medical care is very expensive. So we would love to put a lion's share into preventing the disease rather than treating it, but at times there are certain diseases which cannot be prevented, which are not lifestyle associated. Then finally, direct investment to support interventions and making sure that we talked about how new equipment is important, how making sure that there's a not only initial cost, but also the sustainability and repairs of equipment which may not be functioning. What is the conflict of interest? Now, that is again a very controversial story. Many companies, especially in the earlier days, were basically only funding schemes which help their own employees. Now, that is again changing, as you have seen. It is prone to conflicts. They may be indirectly vouching for their company stake via marketing, social responsibility, strategies, and lobbying. The funding may generate biased favors in favor of the organization, and there may be a lack of evidence and self-regulation, which is of utmost importance. Similarly, success story, this is one equipment I would like to point out. You may have seen it outside. Is an easy check, which is looking at simple investigations like hemoglobin, blood sugar, and creatinine. And there's anemia or lack of hemoglobin in the blood is rampant in our country. Practically 40% of all women and maybe men and children also are really working on a fuel tank which is only half full. So that affects productivity, affects the growth of the child, and the day-to-day activities are obviously sometimes in danger because of this. So this is one equipment. This is about between 30 to 40,000. It was a good, I think about 2.5 crores were given by IOC to the Bhubaneswar-based gentleman who was an engineer working outside, and then he came back and developed this idea. And they already have the necessary regulatory certifications. So if you go to the field, it's very difficult by looking at the eyes whether this person is anemic or not. This gives you objective criteria. It does not tell you the exact blood sugar or bilirubin or creatinine, but it tells you it is high or normal. So you can develop further and take it further. This one thing I saw a small YouTube video on this, and I was really impressed. And I'm sure there are many such inventions and innovations which are there in the market. Success stories, I think, is very important. We always talk negative, that this is not happening, that is not happening. We should always talk about success stories, and so that people can not only be thinking that they can also do it. If, for example, Reliance Foundation looked at a primary health center in Gujarat and also started occupation health setups, which is state of the art. Similarly, they had the HIV, that is AIDS, and tuberculosis. They often go hand in hand. We just heard we are hoping to eliminate tuberculosis in the next few years. Sounds a bit difficult, but at least we are giving it a try. And it is one of the most common chronic infectious disease in the country, and also mostly avoidable and totally treatable by and large. Similarly, you have NCD country, you have Tata Sustainability Group. We heard about Tata Memorial Center in Bombay. I don't think I need to elaborate on that. We have Project Rishta, which is government of Jharkhand, talking about adolescent physical and mental health. And the hospital management system, I think, if I'm not mistaken, the recent problem that we had with the All India Institute of Medical Sciences, the entire system was actually made by TCS. It was unfortunate it had to be hacked. We have to have the necessary measures so that it doesn't happen, because personal data of so many, especially health data, is of extreme importance. Nobody will argue against that. But a lot of these softwares are being given practically free to the government setup at least, and also I'm sure more organizations will be involved. So before I finish, I will like to talk about what is the way forward, because success stories are good. Sometimes you have negative stories as well, no argument, because a lot of money is put in, a lot of effort goes in, and you find that it is down the drain, or it is being usurped by malicious people, which unfortunately is a fact of life. So that is why regulation in CSR is of utmost importance. So involvement is, as we well know, I talked about conflict of interest. It should be considered beforehand. And, in our country, especially when we look at projects, we look at, okay, this is the plan, this is what it will cost, and at the end of the day, this is what the advantage is going to be. And in a hurry, we start the program. But the wise owls and the more practiced and experienced players tell us it is extremely important to do the proper planning, making sure you have safeguards, you have the appropriate national or even international advisory committee to guide and also make sure we don't tread a path which is not appropriate for that particular organization. Similarly, moving forwards, CSR efforts can effectively guide our nation to a NCD-free pathway. Strengthening of CSR activities is the key to NCD prevention and management. So, while we talk about public-private, making sure that the private is equally involved, I know there are various challenges, but as they say, where there is a will, there is a way. Thank you so much. This is my ID, and if anybody wants to have any questions, please do feel free to get in touch with me. I am always just an email away, as they say. And thank you once again, organizers, for giving me this opportunity and for your patient hearing. Thank you.